They were planning on blocking people from using the emergency room, or at least paying for the emergency room. Tell us about this.
Sure. So, yeah, a couple weeks ago, UnitedHealthcare announced this new policy where they were going to start more heavily scrutinizing emergency room visits to assess whether it was, whether these are true emergencies. And so they would then deny or limit coverage in those cases. But what we found is that UnitedHealthcare has been doing, something like this for some time now, where they've been retroactively denying people's emergency room visits, saying that it didn't meet the definition of an emergency, or that, physician documentation didn't support it. And they've done this in some pretty egregious cases that definitely seem like emergencies, or at least where people, had good reason to think it might be an emergency when they went to the ER.
That's incredible. I noticed that there was another article. It wasn't, I don't think it was Daily Poster, but there was another piece that I got in the mail this morning or yesterday about how the union, apparently the oversight group for the unions in New York that handles their health insurance and stuff, just flipped a bunch of union retirees off Medicare, where they were just basically paying for a Medicare Medigap policy. Flip them off Medicare onto Medicare Advantage. This is presumably UnitedHealthcare, and they're the largest Medicare Advantage provider in the country. And so the deductibles went from $1,000 and change to $7,000 and change. And now if you want to have a procedure or show up in the ER, you've got to get the permission of the health insurance company, instead of just, what normal people on normal Medicare, you just get whatever you need or whatever you want, and Medicare pays for it. I'm not asking you to comment specifically on that, but it seems like there's this much larger trend of the health insurance companies just tightening the screws on anybody that they can control, whether it's retirees who are now being shifted into Medicare Advantage on the, which is privatized health insurance. It's not actually Medicare. It's, these BS policies that were promoted by the Bush administration back in 2005, or whether it's, the story that you're telling. I mean, tell us a story about this kid who had the autoimmune disorder, for example.
Yeah. So we spoke to a physician who brought his son to the ER twice in the span of a couple of weeks, because his son was vomiting for several weeks, feeling nauseous, experiencing bad reflux. And I guess while he was at the ER the first time, they did some tests on him. They admitted him, they did some tests, and they found that he had an autoimmune disorder that it had newly onset. It's actually a fairly common one, but it's afterwards, the UnitedHealthcare denied some of the bills here, saying that that it wasn't an emergency, that the physician documentation didn't support that. But this guy is a physician, and he just couldn't believe that this is happening to him. And they left him with $7,000 in bills. UnitedHealthcare did, and one of these hospital staffing companies is now demanding $4,000 from him. Because, they want to get paid one way or another, obviously. And, yeah, UnitedHealthcare has denied it so far. And he hired a lawyer who we talked to, and she helped connect us with another one of her patients. But, yeah, we found several complaints like this where, people, bring their kids to the ER when they're this family in Washington State brought their young daughter to the ER after, she woke up gasping for air. They called 911. Paramedics said get her to the ER, and she had croup, which is not a fatal disease, but it's one of those things where you're supposed to seek medical care, right, if you can't breathe, especially in children if they can't breathe. So UnitedHealthcare ended up approving that appeal, but that's sort of what they're starting to demand that people actually do. They're saying, if they suspect that that something's not an emergency, they're going to make you complete this attestation, they write to them why it is, prove to them it is an emergency. But there are federal rules here where you're supposed to be able to seek emergency care on insurance if you need to, and obviously people who are uninsured are also protected going to the emergency room too. But yeah, so there are federal rules here, and some organizations have said this policy might violate those rules, the federal layperson standard, prudent layperson standard. which is this idea that if you think that you're having a serious emergency, that you think it'll, whatever's happening to you can affect your, your well-being permanently, like you should be able to go to the ER. So it's one of the reasons this is even happening is obviously hospitals have grown increasingly expensive. Emergency rooms are one of the most expensive places you can seek care. But they're there for a reason. Mm-hmm. They are there for a reason, and there are rules that are meant to protect you if you go to the ER.
Right. Yeah, for sure. And in fact, if you go to the ER for some just, hey, I've got an ingrown toenail, they won't let you in. I mean, or they'll immediately say, okay, you're out. But although that would still generate a bill. So we're talking with Andrew Perez, senior editor at the Daily Poster, dailyposter.com. So Andrew, if any of the people who are listening or watching right now and have health insurance through I'm assuming UnitedHealthcare is not the only company doing this, and if they are the only company doing this, within a year it'll be a trend across all of these giant blood-sucking ticks that have attached themselves to the back of our nation, the so-called health insurance companies. If this happens to somebody, what should they do?
Yeah, I would say definitely appeal, definitely write to your state regulator if you're on an individual health insurance plan or a small group plan. And otherwise, the Department of Labor also takes complaints from people on employer-funded plans, which probably would be most people who have health insurance or on employer-funded plans. But yeah, I would say definitely file a complaint if you have an issue. I would say they'll probably, in a lot of these cases, actually accept the appeal. I think the point here is to deny, these claims out, at least initially. I do think they probably expect that people will appeal, but the truth is most people do not appeal. It's not an easy.
Yeah. Whoop. Andrew, did I lose you? Andrew? Andrew's talking, but I'm not hearing him. I don't know what happened. But, Andrew, you made a great point, and if you can hear me, I can't hear you. So hopefully our computers that run the phone systems have not died on us. But anyhow, Andrew, thank you so much for sharing that with us. People can check it out at dailyposter.com, Andrew Perez, DC on Twitter, or Daily Poster on Twitter as well. Andrew Perez. We'll be right back. Thank you, Andrew. We'll be back with more of the news of the day and your calls after this.